Okay, I'm going to present you a journal club example and discuss a little bit of the elements that I want to see in a journal club, how it should be presented. Then the elements that we want to see is that you are going to present the title, the journal, the authors, a rationale why you selected the particular paper, what was important, the highlight, and then you go through the presentation in the order of the structure of the paper with the introduction, the objectives, the method, result, discussion, conclusion. But the discussion and the conclusion is going to be complemented by your own interpretation of those results, the discussion, and that conclusion, in contrast with the things that you have been learning or have from experience or previous knowledge. Then let's start with this paper that is called Investigating the Quality of Mobile Apps for Drug-Drug Interaction, that is also called DDI management using mobile app rating score, that is called MARS, and a structure of clustering k-means. This is a systematic search in apps and score analysis. The authors is a former mentee of myself, Ayush Bhattacharya, and myself. It has been published in the JMIR, the Journal of Medical Informatics Research, mHealth, Mobile Health, and uHealth in May 2025. You can find the article in the link. Then let's look a little bit about the authors. Then most of you know a little bit about me. At that moment, I was associate professor and academic program director of Weill Cornell. You can find my reference there. Now I'm doing a lot of new things. And Ayush is a data scientist, and he works in the pharma industry right now, doing some consumer health informatics approaches. Why selecting this? Of course, is a recent paper. It shows some interesting methods for mobile health applications, and it serves as an example for this one. Then, when we are talking about drug-drug interactions, we can have really serious issues compromising the safety of patient, no? And if we harm some patients, sometimes that's going to increase the cost. And the hypothesis is that mobile apps offer solutions for managing those interactions. Yet, the quality and effectiveness of these applications is unclear. Then we wanted to see if applying some published methods of evaluating quality of apps, they were having a correlation with the perceived quality of the apps or the application of the users. Then we wanted to evaluate the quality of those public available mobile apps that manage drug-drug interactions. And we use the MARS, that is the mobile app rating scales, and the identify patterns in user preference, basically using the scoring in the review boards. We use an approach that is called an apps review, that is kind of a Prisma modified, that is the same technique that is used for doing systematics review. We had two evaluators that were experts in mobile app rating, and then we utilize machine learning methods that is called k-means clusters based on that MARS. Basically, if we have some scores, we separate the clusters and try to see if there is any correlation or anything that we can map to the apps rating provided by the users. The inclusion criteria for selecting the apps, they need to be in English language. And exclusion criteria was the app was designed only for professionals, or was designed for animals and pets, or were for a disease or a specific medication. They were not able to handle more than one disease or more than one pharmacological profile. We use different search words for the apps stores or the app or Google Play. Is that something interesting? When you are doing these searches, they don't have really a semantic search. You need to do a actual string search. then that's something that sometimes difficults the retrieval of information, because if you don't have this in the title of the description, it's going to be really difficult to pull. Then, as I mentioned, we used 2 evaluator master students. Then we extended that to 4. Mars is a 23 item rating scale that is expert based. There is a modified one that is for users, and it has a 5-point Larker scale to give the scores to the applications. And it has 4 main dimensions that are engagement, feature, aesthetics, information, and quality, that is perceived quality. We excluded that one because we wanted to see how things perform from the point of view of the user. Since we didn't have the original users for the evaluation, but we have the gradings, then we did that in the other direction. And then we create plots looking for normality. We did a Kurzweil-Wallis analysis to different subgroups. These are a non-parametric approach since the sample size is relatively small. And then a correlation analysis for the k-means. Then we wanted to identify those clusters based on the different Mars dimensions. And we utilize the elbow plot. That is a way to optimize the number of clusters. That's basically looking at when we don't gain more information when we are creating more clusters. And we use visual analytics based on scatter plots to try to identify things and create those relationships with the users. Then in the identification phase, we started with 1,045 apps. Those we were able to include 117, and we excluded 5 for the application of criteria. Then we collected them, those 112, and then we excluded additional 93 because or they were for a specific medication. They were just oriented for providers and not patients, or different things. Then at the end we evaluated 19 apps. The 19 apps, you can see the names on the left, and you can see the different ratings that the app have in the Google Play Store or the Apple Store. And then we created a weighted average rating with the contribution. As you see, some apps are exclusively for Google or for Android, and the others are just for iOS. Then that's the reason why we see some discrepancies there. And it's interesting how there are huge utilization of some of them, and others that are really low utilization. And there are some interesting things. And these are the scores for Mars for engagement, functionality, aesthetics, information, and the mean Mars overall that we obtain for the different applications. In general, we see that the lowest score was in engagement. Then these tools sometimes they don't really provide a lot of interactivity with the user. But what we were looking for is functionality that accomplish the goal of really identifying those drop interactions just in time, or when you are adding a new one. Aesthetics usually is not that important, but it seems that people are paying a lot of information, a lot of effort in that. And information is the highest score because this seems to be more than engagement or interactive tools, they're informational tools. Then that's the reason why the score is a little bit higher. But as you see, all of them are around the between 3 and 4. Then they're relatively good scores. And then here we just try to see the distribution of the expected values and the observed values, and it seems to be well adjusted. And of course, this is the correlation between the different dimensions, how they come together, or what is the weight that we have in that. And if you see the blue one is because they have positive correlation. There could be negative correlation, but it seems that they are all going in the same direction. Then as the engagement increases, it seems that the functionality, aesthetics, and information, but it's not a clear driver, which is the one that is driving that. It seems that aesthetics is the one that has the most influence because it has a 0.92, 0.99 influence in engagement and functionality or in their relationship. And information is not really related with aesthetics, but information seems to be more in alignment with the other two functions. But seems that even though the theory has told us that aesthetics is not that important, it seems that's being a really important driver here. And this is the elbow plot that I mentioned, and then we selected 3 because more information is not, more clusters is not giving us more information. And when we observe this, then we distinguish there are 3 classes basically. There are classes that perform low in all domains. There are classes that perform in the middle, and apps that are really, really good performers. Then this was interesting. There was a clear distinction among the different groups. And when we plot them and in the correlation matrix, we still see them across the pairs of observations. That is clear distinctions that the low performance in one dimension, they are also performing lower in the other dimension, the middle in the middle, and the high performance are in the high. And here are some correlations and the weighted rating marks in the clusters. And as you see, the cluster number 1, that is that one that lower performance, it seems that those apps are really good in giving information because they are scoring, they have a higher correlation when you provide that, and they have a high engagement, but aesthetics and functionality was not there. And basically, probably the functionality is the element that is driving the lower score there. And the high performers, you see, they are really, really invested in aesthetics, and they are doing a really good job in information, even though, as you notice, they are the ones that actually has better functionality when we observe there, regardless of the aesthetics or the information. Then this is what I was telling you, that aesthetics, they were moderated, but they have variability. And when some apps are visually appealing and they have a pleasant user experience, others that are really going to be short in terms of design and visual coherence. And this is going to be really interesting in the way that the people is scoring things, because we really like to have that nice visual experience, but at the end, the functionality, the performance doesn't come from aesthetics, it comes from being able to accomplish the goal or the function. There are no difference between the mean values of the dimension, but the variability scores could be for other factors. And as I mentioned, cluster 1 is more dedicated for information and engagement as the driver of satisfaction, what cluster 2 is not clear, and cluster 3 having information and aesthetics were the main drivers. Of course, we have some limitations in this study because the language, we have a cross-sectional approach. It was not following patients. The search strategy, as I mentioned before, we had missed some of the elements that we were looking for because we didn't include them in the search list. We can have selection bias for the way that we created the search, or even the way that we approach or selected terms. Also, the public sentiment or marketing is going to be an influencer here, and of course the low number of evaluators that didn't create a lot of at least variability, or we didn't conduct a integrated reliability assessment between the evaluators, and we need further evaluation that incorporates the actual perception of the user, not just the score in the store, but actually conducting that with users. But in the end, we can say that we assessed 19 mobile apps that are designed to check for drug-drug interactions, and we use a Mars scale for that. And they were not that bad, 3.54 score in general. And information dimensions is the one that is providing the highest value, and engagement has the lowest value. Those are consistent with the nature of these apps, and we have another paper that we can contrast it, that we identify class of apps. There are apps that we want to be really, really interactive, and apps that we want to be informational. Then those that we want to be informational, we are expecting the information dimension to be higher than the engagement, and vice versa. Okay, then we identify these different drivers where aesthetics were playing a really good role in the evaluation, even though aesthetics usually they don't have a really big influence in the performance. And we can confirm that Mars can reflect in some extent the app's quality, but as I mentioned, we need to understand a little bit better what are the intentions, the goals, and how we adjust these methods. Thank you for the attention, and then we have covered the different elements, and it hopefully serves as an example of how to present your journal club. Have a good one.